Charlie Baker focused on more testing and contact tracing to isolate COVID-19 cases and eventually getting our state back open for business. Identifying positive coronavirus patients and then tracking back to find all the other people who may have been exposed is critical in all this. And Western Mass News reporter Audrey Russo has more on both state and local efforts to trace these cases.
Massachusetts is the first in the country to roll out a statewide contact tracing framework. Springfield health officials say they've been doing their own contact tracing for the last few weeks, and they say they have yet to reach out to the state health department on joining forces.
At this point, we have not reached out to date.
Helen Carlton-Harris says several school and Bay State nurses have been working on contact tracing for Springfield's positive COVID-19 cases. The city's Health and Human Services Commissioner says it's possible they could reach out to the state to join their efforts with partners in health. But for now, she explains the sheer numbers of people who need to be contacted by her small team in the city alone.
We put up numbers of 668 today, and so all of those individuals need to be contacted, and then we need to follow up with whomever they give us as individuals that they have been in contact with. So that obviously is hundreds.
And they don't just have to get names, but contact information too of people possibly exposed.
It is difficult because it means that we have to track down individuals, get telephone numbers.
Governor Charlie Baker announcing the state's contact testing program has hired more than 100 workers, and more are needed still.
Part of the reason we're building up this tracing program, this contact tracing program, which I believe is going to be critical to our ability to identify and contain COVID on a go-forward basis, one of the elements that makes this work is an enhanced capacity to test.
Helen Carlton-Harris agreed that contact testing is needed to reopen the state, along with expanded testing. She says even weeks into this pandemic,
we do not have sufficient test kits at this point to test everyone who needs to be tested.
The governor saying today there needs to be a significant decrease in both COVID-19 related deaths and hospitalizations before they can even think about reopening the state. At this point, both of those numbers continue to rise. Now, if you're interested in being a contact tracer, there's more information on mass.gov. In Springfield, Audrey Russo for Western Mass News.